Wait. Did that ice cream just send a lightning bolt through your tooth? Before you scroll past this video, let me ask you something serious. What if I told you that small twinge you're ignoring right now could cost you thousands of dollars and even your tooth in just a few months? Hey everyone, today we're talking about something 68% of Americans ignore until it's too late. The warning signs your teeth are literally screaming for help. And trust me, by the end of this video, you'll know exactly when to stop Googling and start dialing your dentist. So let's jump right in. Here's the thing. Your teeth are actually pretty amazing at telling you when something's wrong. The problem, most of us have become experts at ignoring them. We pop a painkiller, switch to the other side of our mouth, or convince ourselves it'll just go away on its own. But here's what your dentist won't tell you in those Instagram ads. Early detection can be the difference between a simple filling that costs $200 and a root canal plus crown that runs you $2,000 or more. So today, I'm breaking down the 10 most critical warning signs that your teeth need professional attention, and some of these might actually surprise you. Make sure you stick around for number 7 because it's one most people have no idea is even related to dental health. And hey, if you find this helpful, smash that subscribe button and ring the bell so you never miss our health content. Trust me, your future self will thank you. Now let's get into it. Warning sign number 1, persistent tooth sensitivity. Let's start with the big one, tooth sensitivity. Now, I'm not talking about that occasional, ooh, that's cold moment. I'm talking about consistent, sharp pain when you eat something hot, cold, sweet, or even when cold air hits your teeth. Here's what's actually happening. Your tooth enamel, that's the protective outer layer, has worn down or your gums have pulled back, exposing the dentin underneath. Dentin has tiny tubes that lead directly to the nerve of your tooth. So when you sip that iced coffee, you're basically sending a direct message to your tooth's nerve center. Now, why does this matter? Because sensitivity doesn't just happen overnight. It's your tooth's way of saying, hey, something's wrong here. It could be a cavity, gum disease, a cracked tooth, or even aggressive brushing wearing down your enamel. The fix? Your dentist can identify the exact cause. Maybe it's a simple fluoride treatment. Maybe you need a filling, or maybe you need to switch your brushing technique. But ignoring it? That's how you end up needing a root canal. Quick tip before we move on. If you're experiencing sensitivity, avoid super hot or cold foods temporarily, and definitely book that dental appointment within the week. Warning sign number 2, bleeding gums. And let me bust a myth right here. No, it is not normal for your gums to bleed when you brush or floss. I don't care what you've told yourself for years. If you're seeing pink in the sink regularly, you're likely dealing with gingivitis, the early stage of gum disease. And here's the scary part. According to the CDC, almost half of American adults over 30 have some form of gum disease, and many have no idea. Let me break down what's happening. Plaque buildup along your gum line is causing inflammation. Your gums become swollen, tender, and they bleed easily. Left untreated, gingivitis can progress to periodontitis. That's advanced gum disease, where the infection starts destroying the bone that holds your teeth in place. And we're not just talking about tooth loss here. Recent research has linked gum disease to heart disease, diabetes complications, and even Alzheimer's. Your mouth health is connected to your whole body health. The good news? Caught early, gingivitis is completely reversible with professional cleaning and better home care. But you need to see your dentist ASAP to get on track. If your gums bleed regularly, don't wait another month. Make that appointment today. Warning sign number 3, chronic bad breath, also called halitosis. Now, we all get morning breath or garlic breath, right? That's normal. But I'm talking about bad breath that never seems to go away, no matter how much you brush, floss, or use mouthwash. Here's what most people don't know. Persistent bad breath is often a sign of bacteria buildup in places your toothbrush can't reach, like deep gum pockets, between teeth, or even cavities. Think about it this way. Those bacteria are literally feasting on food particles and producing waste. That waste? That's what you're smelling. Gross, I know, but understanding this is important. Chronic bad breath can indicate gum disease, the most common cause, tooth decay hiding between teeth, a tongue coating you can't see, or even issues like dry mouth, which creates a perfect environment for bacteria. Your dentist can identify the source with a thorough exam. They'll check for hidden cavities, measure your gum pockets, and might even refer you to a specialist if needed. Bottom line, if you've noticed people stepping back when you talk or you're constantly reaching for mints, it's time to see your dentist. This isn't about vanity, it's about health. Warning sign number 4, tooth pain or toothache. Number 4 seems obvious, but you'd be shocked how many people try to tough out a toothache. Listen to me, tooth pain is never normal, and it never just goes away on its own. Let me explain what tooth pain really means. Your tooth has a nerve inside, protected by layers of enamel and dentin. When you feel pain, it means something has breached those defenses and is irritating or infecting that nerve. There are different types of tooth pain, and they all mean different things. Sharp, sudden pain when biting could be a crack or a loose filling. Dull, throbbing ache that keeps you up at night, that's often a sign of an abscess, a serious infection. Pain that comes and goes might be a cavity that's getting deeper. Here's the critical part. By the time you feel pain, the problem has already progressed significantly. Cavities don't hurt in the early stages. Pain means you're in the danger zone. And here's something that scares me as someone who researches health topics. Many people take painkillers and assume the problem is solved when the pain stops. Wrong. The infection or decay is still there, getting worse, while you can't feel it. I've heard horror stories of people waiting until their face swells up before seeing a dentist. At that point, you're looking at emergency treatment, possible hospitalization, and serious costs. Rule of thumb, any tooth pain lasting more than a day or two needs professional evaluation. Don't be a hero, get it checked. Warning sign number 5, loose or shifting teeth. Warning sign number 5 is one that should send you running to the dentist, loose or shifting teeth. And no, I'm not talking about kids losing baby teeth. If you're an adult and your teeth feel loose or you notice gaps appearing where there weren't any before, this is a dental emergency. Here's what's likely happening. Advanced gum disease is destroying the bone and tissue that hold your teeth in place. Imagine your teeth like fence posts. If the soil around them erodes, they start wobbling, right? Same concept. Other possible causes include trauma or injury to your mouth, teeth grinding or bruxism that's wearing down support structures, osteoporosis affecting your jawbone, or in rare cases, tumors or cysts. The scary truth? Once bone loss from gum disease occurs, it's permanent. You can't grow that bone back. But early intervention can stop further damage and save your teeth. I've seen cases where people lost perfectly healthy-looking teeth because the bone underneath was gone. Don't let that be you. If you notice any looseness or shifting, call your dentist immediately, like this week. This isn't a wait-and-see situation. Warning sign number 6, swollen jaw or face. Number 6, facial or jaw swelling. If you wake up and one side of your face looks like you're storing nuts for winter, that's your body's alarm system going haywire. Facial swelling related to teeth usually means one thing, infection. And dental infections are no joke. We're talking about abscessed teeth, where bacteria have invaded the tooth's pulp and are now creating pockets of pus. Here's why this is so serious. Your mouth is very close to your brain and major blood vessels. In rare but real cases, untreated dental infections can spread to your sinuses, jawbone, or even your bloodstream, leading to sepsis, a serious, life-threatening condition. Warning signs of a dental emergency: swelling that's getting worse, fever, difficulty swallowing or breathing, swelling under your tongue or in your neck. If you have facial swelling with fever or breathing difficulties, go to the ER immediately. This isn't a call the dentist Monday situation. For other swelling without those severe symptoms, still call your dentist right away. You'll likely need antibiotics and treatment ASAP. Warning sign number 7, white spots or discoloration on your teeth. Here's number 7, the one most people ignore: white spots, dark spots, or unusual discoloration on your teeth. And this is where things get interesting because the color actually tells you different things. White spots or chalky areas? These are often the first sign of tooth decay, even before a cavity forms. Your enamel is losing minerals, demineralization, and it's showing up as a white, cloudy area. Caught at this stage, your dentist can actually reverse it with fluoride treatments and better oral hygiene. Dark or brown spots? This could be a cavity that's already formed, a stain, or even dead tooth tissue. Each needs different treatment. Gray tooth? If one tooth looks noticeably gray or dark compared to the others, the nerve might be dying or dead, often from trauma you might not even remember. Here's what blows my mind. These early warning signs are your teeth literally showing you a problem before you feel any pain. It's like your check engine light coming on before your car breaks down. But most people see these spots and think, it's just a stain. 6 months later, they're in the dentist chair needing a root canal. Get any unexplained discoloration checked out. It takes 5 minutes for a dentist to assess, and it could save you major money and pain. Warning sign number 8, receding gums, or when your teeth start looking longer than they used to. This is subtle, so many people don't notice until it's advanced. Your gums are supposed to cover the roots of your teeth. When they recede, they expose those roots which aren't protected by enamel. This leads to sensitivity, increased decay risk, and eventually tooth loss. What causes gum recession? Aggressive brushing. Yes, you can brush too hard. Gum disease, the most common cause. Genetics, some people are just more prone. Tobacco use, grinding your teeth, or poor dental hygiene. Here's a simple test. Look at your teeth in the mirror. Can you see more of your tooth than you could a year ago? Do your teeth look long? Can you see or feel a notch at the gum line? The tricky part about gum recession is it happens slowly. It's like watching your hair grow. You don't notice day to day, but compare photos from 2 years ago and boom, there's the difference. Modern dentistry has great options for treating gum recession, from deep cleaning to gum grafts, but the key is catching it early. If you suspect recession, book a dental checkup. Your dentist can measure your gum levels and create a treatment plan. Warning sign number 9 affects millions but is rarely talked about. Jaw pain, clicking, or popping, especially when you chew or yawn. This could be TMJ disorder or temporomandibular joint disorder, and while it's not always serious, it can significantly impact your quality of life and indicate dental issues. What to watch for? Clicking or popping sounds when you open your mouth, jaw pain or soreness, especially in the morning, difficulty opening your mouth fully, jaw locking in the open or closed position, and headaches that seem to originate from your jaw area. TMJ problems can be caused by teeth grinding or clenching, often at night, misaligned bite, arthritis in the jaw joint, injury or trauma, or stress, which causes jaw clenching. Your dentist can evaluate your bite, check for grinding damage, and might create a custom night guard to protect your teeth. In some cases, they'll refer you to a TMJ specialist. Don't ignore jaw issues. They won't fix themselves, and they often get progressively worse. Plus, chronic teeth grinding can literally wear your teeth down to nubs over time. Early intervention is key here. And finally, warning sign number 10, mouth sores, ulcers, or white or red patches that don't heal within 2 weeks. Now, most mouth sores are harmless. Canker sores, minor bite injuries, they heal on their own. But a sore that sticks around? That needs professional evaluation. Here's why this is critical. Oral cancer rates are rising, especially among younger adults. According to the American Cancer Society, over 54,000 people in the US will be diagnosed with oral cancer this year. Warning signs that need immediate dental attention? Any sore lasting more than 2 weeks, white or red patches in your mouth, a lump or thickening in your cheek, numbness in your tongue or mouth, difficulty swallowing or persistent sore throat. Risk factors include tobacco use, heavy alcohol consumption, HPV, and excessive sun exposure to your lips. But here's the thing, oral cancer can affect anyone, even people with no risk factors. Your dentist is trained to spot early signs of oral cancer during routine exams. This is literally one of the most important reasons for regular checkups. If you notice any unusual sores or changes in your mouth tissue, get it checked immediately. Early detection of oral cancer has a 90% survival rate. Caught late? That drops dramatically. Don't mess around with this one. Bonus tips section. Okay, before we wrap up, let me give you 3 quick bonus tips that'll help you stay ahead of dental problems. Tip number 1. Don't wait for pain. Most dental problems are painless in the early stages. By the time it hurts, you're past the easy fix. Get regular checkups. Every 6 months is the standard, but your dentist might recommend more frequent visits if you're high risk. Tip number 2, trust your gut. If something feels different in your mouth, even if you can't explain it, get it checked. You know your body better than anyone. Tip number 3, dental insurance or not, prevention is cheaper than treatment. A routine cleaning costs $75 to $200. A crown and root canal? $2,000 to $3,000. Do the math. And here's something important. Many dental schools offer reduced-cost services performed by supervised students. Community health centers also provide affordable dental care. Don't let cost be the reason you skip care. There are options. Conclusion. All right, everyone, let's recap real quick. The 10 warning signs are: Number 1, persistent sensitivity. Number 2, bleeding gums. Number 3, chronic bad breath. Number 4, tooth pain. Number 5, loose or shifting teeth. Number 6, facial swelling. Number 7, white spots or discoloration. Number 8, receding gums. Number 9, jaw pain or clicking. Number 10, mouth sores that don't heal. Here's my challenge to you. Look in the mirror right now. Do you have any of these signs? If yes, call your dentist tomorrow, not next month, tomorrow. Your teeth are the only part of your skeleton you clean every day. Treat them with respect. They've got to last you a lifetime. Now, I want to hear from you in the comments. What dental issue made you finally go to the dentist? Let's help each other out and share our experiences. Your story might convince someone else to get the care they need.